my distinct pleasure and honor to be able to join you as we prepare for the Global Fund's 7th replenishment. We do so as we mark 2 decades of global partnership under the most consequential of global initiatives. As we convene to chart the future, let us reflect on what we have collectively accomplished in addressing HIV, TB, malaria, and most recently, COVID-19. Your Excellencies, ladies and gentlemen, over the last 2 decades, our collective efforts have restored dignity to vulnerable people through proactive social programs, and Kenya specifically acknowledges the critical role played by the Global Fund Partnership in addressing HIV, TB, and malaria across the globe, which has saved at least 44 million lives for all of us. These, ladies and gentlemen, are not just mere statistics. We are talking about 44 million people, real lives saved and made better because we believed that we can deliver a better future. Your Excellencies, ladies and gentlemen, since 2002, the Global Fund has been a partner in advancing the Kenya government's agenda of ensuring universal access to health services for the Kenyan people. Through our partnership, we have brought hope where there was despair, comfort where there was fear and uncertainty, and we have brought stability to households that were rocked by social economic turmoil. To date, the Global Fund has signed in favor of Kenya grants amounting to over US $1.8 billion and dispersed over 1.4 billion, and these grants have supplemented the Kenya government's efforts to address the 3 diseases of global concern. While at the same time, these funds have also helped to strengthen our health service delivery, our health service infrastructure, as well as community systems. I cannot overemphasize the strong community health systems, which are a key pillar in the prevention and management of these preventable diseases, as well as building both response capacity and resilience to emerging epidemics, as well as pandemics. Working together with the Global Fund and other partners, Kenya has made great strides across the 3 high-impact strategic public health programs between 2013 and 2021. The HIV program, for example, has yielded a 67% decline in annual AIDS-related deaths. This encouraging performance reflects an increase of 83% in the number of people living with HIV that are on life-saving antiretroviral treatment, from 0.66 million people in 2013 to approximately 1.2 million people in 2021. With respect to the TB program, the government of Kenya has recorded a treatment success rate of 85% and a significant decline in the annual TB incidence. Similarly, the malaria program has contributed to the overall reduction of the malaria burden in Kenya, with a national prevalence declining from 8.2% in 2015 to 5.6% in 2021. So, Excellencies, ladies and gentlemen, turning to the COVID-19 pandemic that has presented challenges that have threatened to erode the gains registered in response to HIV, TB, and malaria, this situation has elevated the urgent need to scale up the delivery of universal health coverage for our citizens. my administration continues to put equitable access to health service at the core of our developmental priorities. 2 years ago, I was privileged to be appointed the chair of the African Leaders Malaria Alliance under the auspices of the African Union. On assuming this role, I set forth a 4-point action plan that aimed to eliminate malaria across the African continent. The 4-point action plan included, first, digitization, high-level engagement, thirdly, establishment of end malaria councils, and lastly, the mobilization of a malaria youth army to champion youth engagement and promote innovation, research, and development across our continent. So, Your Excellencies, ladies and gentlemen, the African region still faces a lot of challenges we need to overcome if we are to achieve our goal of eliminating malaria by 2030. The first step in this noble journey is to address the significant malaria financing gap in African countries, and indeed, about 63% of activities in national malaria strategic plans in Africa are today currently unfunded. To eliminate malaria in the continent by 2030, we must therefore recommit to keeping the fight against malaria as a priority in our national development agendas. We must mobilize additional domestic resources, empower our communities to act, and also accelerate the deployment of new malaria commodities as well as interventions. It is against this background that I underscore the urgent need to increase our contributions and advocate for additional partnerships ahead of the upcoming 7th Global Fund replenishment to be hosted in the later part of this year, and this by the government of the United States of America. So, Your Excellencies, ladies and gentlemen, Kenya pledged and thereafter honored our contribution during the 3rd, 4th, 5th, and 6th Global Fund replenishment cycles. In the 6th replenishment cycle, my administration contributed $6 million and we plan to enhance our commitment for the 7th replenishment cycle in support of the Global Fund. I call upon all implementer countries to remain at the forefront of championing and advocating for a successful 7th replenishment of the Global Fund. The replenishment cycle comes at a time when economies globally are faced with the challenge of the COVID-19 pandemic. This pandemic has underscored the need for global solidarity to curb not just COVID-19, but to curb all diseases that afflict our people. It is clear that increased investment in strong community and health systems is needed now more than ever before if we are to tackle both prevailing as well as emerging diseases. Equally important and urgent is the need to build our continental capacity to manufacture commodities for sustainability and resilience. And this calls for all of us as a continent to talk in one voice to ensure that our homegrown solutions and strategies are adopted in the fight against these diseases. As we put resources to this noble cause, I call upon all of us to unreservedly commit to upholding good governance and ensuring utmost transparency and accountability of the fund. That way, we can expect to reap maximum benefits from these resources. Your Excellencies, ladies and gentlemen, going forward, I therefore call upon all governments and indeed all stakeholders, including the private sector, to join us in enhancing the pledges made during the 7th replenishment cycle that we anticipate in the later part of this year. I do believe that none of us will regret investing in this worthy venture. And why do I say so? Because a healthy population means higher productivity and therefore a bigger national and ultimately a bigger global cake for all of us. Therefore, ladies and gentlemen, let us together fight for what counts and mobilize the much-needed resources to end the epidemics of HIV, TB, and malaria. The conscience of the extraordinary alliance of all partner states under the auspices of the Global Fund is summoned to order and to the benefit of humankind. I thank you all for your kind attention.